Hi, welcome to the lung page. Today we are going to discuss part 3, final MBBS medical students exam preparation, respiratory based MCQs. So this is a question. What is the gold standard for pneumonia diagnosis? First chest x-ray, CT scan, clinical features and microbiological confirmation. So we all know pneumonia is bacterial infection in the lung or lung parenchyma. So what is the very important thing for the gold standard diagnosis is answer is microbiological confirmation or otherwise culture ABST, because chest x-ray we can identify there's a clue is there. CT scan also give us clue, clinical feature also give us clue, but the microbiological confirmation that is give the definitive organism, which organism caused this pneumonia. So gold standard is microbiological confirmation. Because of this only we can go for the specific antibiotic choice. So when you ask about the gold standard method, so what is a specific investigation for pneumonia? Answer is microbiological confirmation. Okay, we'll move to the next question. Which organism cause pneumonia with hemolytic anemia? So it's very interesting question. It's a very common question they will ask in the final MBBS. Which organism cause pneumonia with hemolytic anemia? Legionella, Mycoplasma, and Klebsiella staph aureus. So answer is what? Mycoplasma. So Mycoplasma is a atypical pneumonia. It's called hemolysis because cold agglutinin. So here is a diagram shows Mycoplasma pneumonia. What are the main features? Mycoplasma pneumonia usually called as a atypical or walking pneumonia. Clinical features mainly atypical. I mean dry and persistent cough, low grade fever, sore throat, headache, malaise, those things are the very subtle features. Chest X-ray finding mainly minimal, and also sometimes auscultation also very minimal finding are there. Some other extrapulmonary manifestations are very important from the Mycoplasma pneumonia other than that chest manifestation. Rash that called erythema multiforme, targeted signs are there. Sometimes encephalitis, myocarditis. Very important thing is hemolytic anemia due to cold agglutinin. When you go to the image finding, chest x-ray mainly patchy shadows are there. So very subtle changes are there. Laboratory findings very important. We can do the blood test, WBC normal or mild elevated, CRP usually elevated, and hemoglobin level usually low because of this hemolysis. And microbiological confirmation, so we can do the culture this microorganism. So PCR is very gold standard for these patients. So throat or sputum PCR for mycoplasma is gold standard, and serum IgM or supportive. So how can we manage mycoplasma? Mycoplasma usually managed with the microlides. So here we can't give beta lactam, so it's not effective because beta lactam mainly act on the cell wall. Here this mycoplasma intracellular pathogens, no cell wall. So here first line treatment macrolides. Alternatively we can go for the doxycycline. So I think now you clear about this mycoplasma. Okay, stay tuned. So this is my page. Subscribe and follow in the Facebook as well as in the TikTok. Bye.